I paid the price.
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 For every 1 out of 9 women, the diagnosis of breast cancer will become a reality and exact a price to pay.
Probably the first thing that anybody thinks about when they're told that they have cancer is, are they going to live or are they going to die?
It came as a total shock because no one in my family ever had cancer.
I thought they had the wrong person. It seemed unbelievable to me.
And of course, all kinds of things go through your mind. You want to be alive for your children. You want to be alive to do all the things that you've planned to do with your husband.
I remember being terrified. I wanted to run away. Didn't want it to be real. I wanted to crawl up in a ball and wake up and have it be somebody else. I didn't want to have cancer, not me.
25 years ago, I was diagnosed for the first time. Second time was just 5 years ago, diagnosed again in the opposite breast. 6 months ago, I was diagnosed for yet the third time with breast cancer.
When we began seeing this pandemic of breast cancer, in the beginning, our options were limited. Surgery, chemotherapy, radiation.
I had to undergo chemotherapy first. Then I had a double mastectomy with immediate reconstruction. I also had an oophorectomy and I had radiation treatments.
Chemotherapy followed by 1 year of Herceptin, which was to protect me from further cancer.
I went through the traditional radiation treatment and thought I was free and clear, but I wasn't.
These treatments had mixed results. Some were promising, some were not. We knew there had to be something that had greater promise, something that got right to the heart of the matter.
For the first time in the history of breast cancer research and cancer research in general, we have been finding success in a treatment that not only eliminates the cancer, but that keeps it from coming back.
This vaccine was just so important because I feel like it will prevent a cancer recurrence and keep me cancer-free.
When anybody says that they have breast cancer, my first comment to them is go down to the University of Pennsylvania and see Dr. Zernecki.
By targeting the HER2 receptor, we have found to date what is the most promising and effective treatment for breast cancer. Our patients have had incredible results with this treatment. It turns the immune response into a seek and destroy patrol.
I received the vaccine in June and July of 2007, so I've been cancer-free since then.
I have blood work done every 6 months, and it's been 8 years that I have been cancer-free, and I still have the antibodies that fight the HER2.
I've been cancer-free for 2 years.
Approximately 80 patients have received the vaccine over the last 9 years, and none of them have recurred with HER2.
I feel like I am through with all the cancer.
But now comes the heavy lifting.
We are at a critical junction in this work. Our results are very promising for breast cancer, but they also may be applicable to other tumor types.
I think there should be a cure in my lifetime. I think if we all get involved, there will be a cure. But it takes just a penny or a dollar from everyone, and there'll be a cure, because they're on the verge of this cure right now.
Right now, we're ready to expand into our final stages of clinical trials. But we cannot do it without all of you.
We manufacture these vaccines in our own laboratory. Each patient receives their own personalized vaccine, and the process is expensive. We need 2 more machines to manufacture more of these vaccines.
I think that Dr. Zernecki and the researchers at Penn are on to something extraordinary, that this might not just be the cure for breast cancer, this could be the cure for every cancer. So donate generously to cancer research.
To help Dr. Zernecki move his revolutionary treatment for breast cancer into the mainstream, we need your support. Pennies in Action is a 501c3 charitable organization that is helping Dr. Zernecki realize his dream of putting breast cancer behind us.
We hope that you will donate to Pennies in Action because right now there is no other way for a patient to get this vaccine. And we have to come up with $25,000 per patient. And if we don't have that money, the patient can't get the vaccine. It's as simple as that.
Donating money to Pennies in Action will help another patient just like me. And that patient might be your mother, your wife, your daughter, your sister.
Will you pay the price?
Will you pay the price?
Will you pay the price? The price of promise?
The promise for the patient is in this vaccine, their own personalized promise.
I'm getting a promise and a hope of being able to grow old with my husband and raise my children.
We're going to kill this enemy. We're going to get rid of cancer, and there will be a life without cancer.
You too can help pay the price of promise. A promise that's worth the price.
To make a tax-deductible contribution, contact Uschi Kessler at Pennies in Action.